When you take the AEROECLIPSE Nebulizer out of the bag, it looks just like this. There's nothing to assemble, except to securely attach tubing to the bottom of the nebulizer. To add the medication, unscrew the top, add the medication, and then fit the white piece over the clear stem inside the nebulizer cup. Then tighten the top. You won't be able to over-tighten it. It can be filled to a max of 6 milliliters, and there are some lines on the side to help you with fill volumes. There's also a spill guard inside, which allows you to nebulize at an angle or side to side. With the tubing attached to the bottom of the nebulizer, turn your wall air to 7 or 8 liters. Then take the other end of the tubing and attach it securely to the flow meter. The ball at the flow meter may drop from its original setting, but there's no need to readjust. The first thing you're going to notice is that the nebulizer doesn't start creating a mist. That's because it's breath actuated. Watch this green button right here. When the green button is down as the patient inhales, the nebulizer will create aerosol. When the button moves back up, the patient is exhaling or taking a break, and aerosol stops being created. This means that it will not nebulize until either the patient takes a breath in or you activate it using your finger, locking the green button down, which will also start aerosol production. If you need to change the nebulizer from breath-actuated mode to run continuously, like when using a disposable face mask, simply rotate the dial on the top a quarter turn. It's important to coach and encourage patients to use good technique and take a breath-actuated treatment using a mouthpiece whenever possible. Patients should be sitting up or semi-reclined in a comfortable position. Make sure their lips don't block the exhalation port on the mouthpiece and that it's facing down. Once the treatment is complete, you can unscrew the top, shake out the excess medication, and let it air dry, unless your facility has other cleaning procedures that you need to follow. If you're using the band nebulizer with the filtered mouthpiece kit, simply remove the mouthpiece from the nebulizer and replace it with an assembled filter kit. Treatment instructions remain the same with this added accessory. One of the biggest benefits of this nebulizer is that it's breath actuated. This means aerosol delivery is activated by the inhaled breath. More medication makes it into the lungs and does not get wasted by being aerosolized when the patient is not actively breathing through the device, like when they talk, cough, or take a break. Breath actuation can also act as a safety feature, minimizing the aerosol escaping into the room and significantly reducing the risk of secondhand exhaled aerosols, which may carry harmful viruses. This wasted aerosol is a possible contaminant for caregivers and families that remain in the room during or after a treatment. Doing treatments with the AEROECLIPSE nebulizer means medication is going where it's needed most, deep into the lungs. You will likely even notice better outcomes for your patients during post-treatment assessments. Better lung deposition, delivery only on inhalation, and much lower environmental emissions means better nebulizer treatments for your patients. Please remember to have a look at the full product insert, and thank you for joining me today.